event is actually today's World Diabetes Day and as well as Children's Day. So, a couple of things. It's very interesting, and as well as things that I'm going to share it with you, which is really shocking. I want to share some stories that actually, that my mother. I have lost my mother. Actually, it's one of the reason was diabetes. Actually, and I am here with Dr. Krishnadev. Dr. Krishnadev saying message to me, saying, "Hi brother, I am taking my grandmother to the hospital, so she was a risk factor." So Jyotidev Krishnadev and as well as Dr. Krishnadev, they are two doctors, are very famous. They are from Trivandrum, and it was really interesting and it was really shocking. Um, that I was in an event in the Dr. Jyotidev and as well as Dr. Krishnadev that place. Krishnadev is actually a son of Jyotidev. They both are specialized in diabetes and they're unbelievable doctors. They are. I couldn't believe I went with for an event for kids. So today's Children's Day, so I thought I'll share that also. Now once again, here we are going to discuss about how serious this is disastrous situation once people get diabetes. And I want to tell you something that many of us don't bother about once you get a diabetes. Okay, now the most important thing here today's message I wanted to pass. Sometimes we are having medication, and like me, I lost my mom, and I want to tell you that it was could have been managed a bit more better. But sometimes, like me, I have programs that I do reverse and prevent diabetics. That's one of my programs. I do it, and when you look at it in that programs, but there is it's a time log is there. You need to be act before rather than you just wait. So you need to understand why or how important is this disease is. That is the most important thing. So once again, I just want to tell, and I was an event today. I was with the actor Mohanlal. I'm in Dubai right now, in my one of my office in Bodyford Holistic Center, Marina, and actor Mohanlal sir was with me, and I just had to drop him. So we had the basic discussion. So I went with him an event also. So once again, I was supposed to be alive on 6, and the traffic jam. I just reached here, and it became a little bit late. So that's why we are starting almost like 5:45, 5:50. So small apology for that. But again, I'm sure a lot of people are joining right now. Am I right? So my basic point is again, once again, the diabetes. It's a disease, and many people don't understand. So here once again, Dr. Krishnadev as well as Dr. Jyotidev, they are one of the best doctors in India, and they are actually they do actually a lot of research. And luckily, I was there in one of their events, so I was shocked with the numbers they were sharing and the kids they are affecting with the disease also. So the basically here they talking about the facts is 537 million adults in 1 in 10. That's a minimum living with diabetes, and we are expecting more again and again. And the numbers are increasing to 643 million by 2030 basically, and by 2040 maybe it will be around 800 million, which is a lot, almost one in every adult, which is 44% of the people have diabetes and remain undiagnosed. And so many people are undiagnosed. They don't know that whether they are having diabetes, which is like almost quarter million. Sorry, it's just like 250 million people. They don't know whether they have this disease or anything. They just live. And many people I've seen when they consult with me and they say, I don't bother, or they're just ignorant. And these people are really ignorant and they don't care. And they don't even go for a test. I've seen so many people, they're just waiting for some really disaster to happen. Almost 1 in 2 adults, which is 44%, and 541 million adults are increased risk of developing by type 2 diabetes, and more than 1.2 million children in adolescents and in age 0 to 19 are struggling with type 1 diabetes. And I told you a few months back, actually last month, when we were shooting a movie, and I had an opportunity to assist actor Mohanlal, and when we went, and there was an event conducted by Dr. Jyotidev Krishnadeva, and as well as these they are very famous doctors, and I was in the program, and it was shocking. You know that it is today's Children's Day. Children's Day, it's a happy Children's Day, but I want to, many of the mothers, many of the parents, they don't know the risk or the challenging factors when the kids get diabetes. And I was shocked, even though I do have a basic knowledge. I am not a specialist. I may able to help you to reduce the symptoms, or maybe I can eventually reverse your diabetes once you get it, because through lifestyle modification, I am not a doctor to prescribe you any medicine, or I am not going to give you anything in this event. And hopefully, the next time, if you wanted to learn more, I have helped 10,000s of people reversing or preventing diabetes with a lifestyle modification as well as some kind of supplementation, which is quite possible, and practically it can be implemented with a small. So in this event, if you are going to stay with next 10-15 minutes more, I'm only going to be there next 10-15 minutes. I'm going to go with all that things. Okay, so let me start with this event. When I went, I it was shocking that the event was in. I was gone for a shoot with actor Mola, the movie called Nere, and the movie was in between movie. One day we had to go for this event, and it was a shocking event, because the data they have given that kids, they get diabetes, the type 1, if they are not managed well, maximum some kids live only by 10 years. They can die, and many kids die. And even though they were talking about a lot of things about how to monitor and managing the symptoms, and when the small kids get it, it's very difficult to manage and monitor. And it was really a disaster situation, and to see with a lot of kids from, it was in Kerala, in Trivandrum, so I've seen hundreds of kids that were affected and came from across Kerala, and it was really shocking. And some kids are really in a need of help and money and managing. But one thing I have seen in all this programs, wherever all the people I know, all there are good doctors out there, but there is very little only in talking. We are talking about lifestyle and lifestyle modification. Yes, the good thing is I heard Dr. Jyotidev was saying in one of his workshop. He said in other places, when you have diseases, many doctors will do diagnose a person, or they will give at least a 20 to 30 minutes of consultation. But especially in India, and other places like undeveloped countries, there is actually a lot of patients, and it's hardly a 1 minute consultation, where uh, the person normally get in touch with the doctor every 6 months or 1 year, and this person is supposed to be guideline every, as per them, with the medications, and every year they need to change and make all the chart for what exactly they need to do it. And hardly the people come, and hardly the education is there, and there will be only a little time the doctors spend with the patient, and the patient get very minimal benefit, because they only just increase the medicine, or they're not looking at the chart, or they're not looking, or not going for a proper diagnostic, and they're not getting the right benefit. So here I just wanted to tell you a couple of things, actually, starting with my mom. When people get affected, you can affect your kidneys, and that's what it happens to my mom, actually. And we couldn't revive her because one of that, it could have been managed better, because maybe for the last 1 year, the food and the lifestyle and activities was reduced. That is a major thing, I believe. Same with many people. I was in the hospital, and it was really a disastrous situation. Out of 100 people, if I say that is 50% of the people were affected with diabetics, and that is one of the reason it was affecting their. When people don't understand, one main thing is when you get diagnosed. I have told many people when many times, many people know about my son also. So I have said a story in my old Instagram saying that many people didn't see that video. I said one day, fine morning, this one of the God came down and asked me in my and said, Dr. Jaison, I'm going to give you a gift. So he saw the board of losing weight 20 kg in 60 days, and God is watching. He's quite overweight, and he wants to lose weight, and he's asking actually, reversing aging, reversing diabetes, reversing cholesterol, reversing blood pressure, fatty liver, and thyroid and PCOD, and he thought maybe I'm good in everything. So he said, okay, I want Dr. Jaison, I would like to give you a gift. And I said, what gift God wants to give to me? And I said, I really am okay, I'm fine. If I have to ask for some gift, that is already, you know, I don't need anything, I'm just okay. So, but God insisted and said, Jaison, you need to take one of it. And I said, which one? He said, I'll give you two options. Either you take cancer or diabetes. And I didn't have an option, so I said to the God, okay, I'll take cancer. What does that mean, basically? You understood, it's just like a joke. I'm saying it's basically, um, yes, diabetes is actually, it's quite disastrous. It can affect your entire body, in your system, your vitality, your eyes, your organs. It's a silent killer. It's a silent killer. I remember a long time back, I was in India. I was catering to a lady who she is a minister's mother, and this lady came to me. She's almost 60, late 60s or 70, and she is quite looking good and all because she managed with all. And but actually, she had a really big belly and she was severely diabetic. And she also saw my program, and we had some machines to reduce like fat freezing and all in the clinic in India in Kerala. And she was just her daughter also was there. She lost around 20 plus kg, and that is why she brought her mom to our place. And this lady, I was telling her, listen, I wanted to make you lose weight, and I wanted to help you to reverse your diabetes. And she said, no, no, I am not bothered. I'm just taking some medicines that doctors have prescribed. I'm just following it. I want to reduce my belly and I want to wear my sari. I want to go, when I go to the church, I just want to have a flat belly. That's all I don't care about any diabetics or cholesterol or BP or anything. And she's actually in late 60s. So her care was like, she just can take some medicine. And the same thing I have seen, sorry to say, we have a lot of good doctors out there, and they save lives. But I've seen when it comes to the program and I say, doctor, how we can manage your diabetic or your cholesterol or your BP, can we do some lifestyle modification, can you enroll in some exercise? And they say, oh no, that I'm quite busy, I have surgeries or I have this and that. But yes, they are inputting. And I have lost actually one of my best doctor who helped to treat my son, his surgery, actually, Dr. Venugopal. He was in not even late 40s or mid 40s. He was having he had a massive heart attack, and doing that long, probably like maybe a long 16 hours work, and it made him a severe heart attack, and he died. So you need to start putting your food. Like I was telling them about the doctors. This one of the doctors I told me, like, yes, I'm taking a couple of capsules every day for cholesterol, BP, and diabetes, and I'm managed and I'm okay. See, this is we call as an ignorant. There are, okay, some people take medication, and even some people don't even take medication. That's even worse. So my point here is basically, if you are suffering with any kind of lifestyle diseases, including diabetics, today's World Diabetic Day, that is why we are here, and to make you understand how disastrous is that. I have seen, I have a very good friend of mine who comes to Power Gym for, and I have another actress friend. There's two people I still remember, amputating. Like from the ankle to the feet to, you know, both the leg, it was really disastrous. And they were getting into the wheelchairs. And, you know, I am telling you guys, there is something I wanted to uh, pass a message in this workshop. You die, but you die healthy. My programs are all talking about why is it reverse aging. I don't want to live. I don't want to live 100. Why do I want to join your program? Why do I want to lose weight? Anyway, you have to die. So die. There's nobody cannot stop it. But when you die healthy. That's the idea. Now I'm writing a book called Die Healthy, which is my experience, especially last 2 3 weeks. I was in hospitals, and if you see there, 50% of the people there suffering is actually based from the lifestyle. I seen when I went all these places, people are hardly moving. They don't do anything. Even if they have a back pain, knee pain, they stop. They don't want to even move. They think that's because of that little knee pain, I don't have to anything. Doctors told that. If I have a little back pain, they stopped. If you are diabetes, if today's World Diabetes Day, and if you are affected with one, and please start doing some action. And their action is very simple. I told you in my old videos, lifestyle modification. The education and the food, people still, I've seen that people start having idlis and dosas, if it's a South Indian. They are still, I don't really understand, because to take the medicine for the diabetics, they are taking food. What is the food the people are taking? Either they have there's something called South Indians. If it's a South Indians, they take it idlis and dosas or puttu or something. So if you are not an Indian or somebody, you don't know this. It's actually comes out of refined rice. Anything is white sugar, refined rice and maida and flour, and as well as white sugar and the white bread, anything like that, even refined white rice, all this is actually pushing straight away that it's spiking your, sugar level very fast. It's like you're injecting with a syringe to your bloodstream. That's the way when you eat this refined rice, the idli, dosa, and they think that it's quite, an idli is a steamed one. They think that it's like quite healthy, and they take it. Actually, it's spiking the blood sugar, and they're taking the medicine. Within 2 hours or 3 hours, their blood sugar again goes down, and they cannot really regulate it. And again, they have to go. And I've seen people just take. Some of the people I was in, I saw to say I was in funeral, and somebody's keep on taking sugar. See, the problem there is basically that glycemic index of the food is the most important thing. People don't understand what is the glycemic index and why sugar is supposed to be managed, 90% managed, supposed to be with lifestyle. Lifestyle is what? Doing some activities, doing some exercises. If you are able to go to a gym and do, if his first place is to start some doing and some kind of activities. Yes, people doing 10, 20 minutes, 30 minutes walking. It's actually not a medicine. But if you're not doing anything, it's even better than a medicine, that one. But if you want to have a medicine, yes, I'm going to run a long workshop about this to reversing and preventing diabetics. And you see, some people saying is, I don't have one, I'm in a border. And if your levels are worth the border, even you are tomorrow, you're going to have one. So please don't wait that I don't have. As I said earlier, in every single year, it's millions of people are joining the party here. You understand? So you have to be very careful. Once you get it, it's quite difficult. And your lifestyle, that the quality of your life is going to diminish. You don't understand what I'm trying to say. I've seen people, they are suffering. Taking a medication, yeah, it is not going to help you. You need to take some medication if you are affected with really high, but if you are in a border or if you are with diabetes, still you can prevent it. If you don't have one, or if you are already there, you can reverse it eventually. So that is what you need to do, is you need to have a small lifestyle modification, small changes. That is what I'm going to educate you. If you wanted to learn in my programs, I do workshops for it, and hopefully I will be sharing the event and the date, and I may be able to do a small workshop for you for free, or maybe I don't know in my calendars which is the date they have shared it. So I will tell you which is the date that is going to come. Now, a lot of people are asking so many questions. I may not able to reply to here, but I can take some of your things, and I can give you videos out there as well. So I will do that later. Now, most important thing is for us is we need to be clear, and we need to be understand how disastrous is the situation. So we are going to we are just going to do, actually the most important thing is basically I want to announce something called Don't Just Live, Die Healthy is a program, and it's actually a book. I'm going to write it, and this program, actually what we are going to part in, we are going to educate people, or whatever the learning or whatever the experience, I'm going to share it with you, and the stories I heard, and I've seen people are suffering. If you are just joined, this is Dr. Jaison, and we are doing today's World Diabetes Day, and as well as Children's Day. And I was just talking about how bad is the diabetes, and as well as when the children get it, it's even worse, and some kids can die before they become even 10 years old. So it's really a disastrous situation, and these are two different way we can manage it. And if you become one of them and you still don't struggle, and you can still die healthy, not you have to suffer. What is that means basically, when you are alive, you have to be better off, means you should not be bedridden. That's the idea we are talking about. We should not be getting into a bedridden situation. Now we have another 7 or 8 minutes more. So what we are going to do is basically, number one, I want you to understand how bad is the situation when you get diabetics. If you are diagnosed with one, immediately start doing. If you are not doing anything there, start doing some activities. That's your first priority. If you can't go to a gym or any other facility, start doing some basic activity, at least walking. But as again, and I underline, it's not a medicine, it's not enough. I am a good fan of weight training, interval weight training, and after that, maybe if I was doing a program for my clients, I will be doing just 5 minutes of walking or cycle. Then I do ask them to do a 30-45 minutes of weight training, which is again interval training. Then I'll ask them to go with 15-20 minutes to 30 minutes cross train or elliptical or a cycle with interval with a heart rate of 120-130 in between, if the person is average around 40-50. That's what I would ask them to do in exercise and activities. And diet ways, yes, everything should be low in glycemic index. When I say low in glycemic index, means if you eat potato and sugar is almost like 80, 90, 100, whereas low in glycemic index, quinoa or oats or sweet potato and oats, when you compare, sweet potato is far better in low in glycemic index than oats. So some people heard it's not potato, sweet potato is almost like a medicine for diabetics. So if you wanted to take every day one piece, if you can avail it, or if you can get it, you can start taking a one piece every day. It can give you a lot of benefit and a lot of proteins. Actually, when you are diabetic, you lose a lot of muscle mass. So you need to consume at least a good quality protein, at least 1 gram per kg. That's a minimum. And when I look at the diet, I was there in these hospitals, and people, actually normal people to patients, they hardly eat protein. They just give them only carbs, either a kanji or a oats porridge or a chapati or parotas or rice, or literally if you look at it, it's actually, even when people get old or get diseases, and they actually ask them to eat very light, or yes, very light is fine, but we need the nutrients, and zero veggies. Now with diabetics, I would again ask you to stay away from sugar and fructose fruits. But there are certain fruits you can eat it. But again, in my other workshop, I may able to help you to share the details. But a lot of veggies. So I done actually a long time back a seminar eating bush. Eating bush can reverse your diabetes. What does that mean? Eating bush. Eating bush means eating a lot of veggies, not starch, not fat. Fat is okay, a little bit of fat is okay, but not starch. Starch is always avoided, and more of veggies. So if your plate is full of veggies, 90%, 80% of veggies and protein, that's what you exactly. If you wanted to prevent, if you want to lose weight, if you want to reverse, everything is a simple rule. So lifestyle is the most important thing, I would say. And I don't want you to be there. Actually, what I've seen, those stories, the people who are suffering, really is disastrous. It is disastrous. So once again, today is World Diabetes Day, and I want to help 1,000 people who's watching my show. I'm going to give a free program of mine for absolutely free. So if you are registering today, I may able to send you the details, and you can start reversing and preventing diabetes and other lifestyle diseases. And I will give you, if you register today, when I publish my book called Die Healthy, and I will be either sending you an electronic version or a physical one to you for absolutely free. So that is only for the first 1,000 people. So you can send a message to us. And what is the number you have to tell me for that? WhatsApp number, if you have any.
Uh,
Yeah, so if you have a WhatsApp number, I'm going to share that WhatsApp number. You can tell me 0. At the same time, so if you are in abroad, it's 00971. It's the Dubai code. So if you are abroad, it's the Dubai code is 0091, and it starts with 5. And I'll
Zero,
keep, huh?
50,
Yeah,
136,
136
9133.
91
Double three.
33.
Yes.
So the number is 00971, and that is the Dubai code, and 5013699133. 5013699133. Anyone is, if you are overweight, and that is actually can aggressively going to diminish. So today you have to take some action. And if you've seen any kids, they are suffering, please, if you want any information, we can give you a lot of new things are available, and new monitors and things. As I said, the doctors that I know, they are occupied with a lot of things. So if you are need any help, please ask whatever the and things I know, I can pass it. But because today here I'm sitting with I count, as I said, cancer and diabetics, and I would choose the cancer, not the diabetics. I pass this message because you understand how serious how it can affect you. Means it can affect you entirely. So please do some action. And I think some of you are in Instagram, some of you on Facebook, some of you are on YouTube watching, some of you are there out in TikTok. So I'm saying thank you very much for participating in it. But I just wanted to take this message, and if you are parents, if your neighbor, if your friends, if your family, if your kids, in your siblings, or anyone out there, and they are just ignoring, or you yourself ignoring that is saying that I'm okay, I'm just taking medication, please do some action. What is the action? Is very simple. Lifestyle modification is the action, not just eating the medicines. And yes, if you're severely infected, you have to follow. Once you start, then you have to take a long time for you to reverse it. But if you are out there on the border or initial stage, it's for you to easier to reverse it. To you don't think that yes. If you ask me, sometimes we cannot prevent it. It's very difficult, and we don't know how it comes as well. So people say it's a hereditary. I'm not diabetic till today. I'm 50 plus. But see, it's not necessary you have to get one because my father have. Exactly like me, I don't have. I may, if I just ignore it, then I'm going back to my lifestyle is bad, and if I'm not exercising and I'm doing eating whatever I want, maybe I can get one in the next 6 months or 1 year. You understand? And I was there, I know that, and I was there when my son had some problems, and I was there, almost there, and I had to reverse it. So if you are there, um, I want you to be, finally, I'm requesting, I'm insisting, I am just telling you, please take some action. And this is my request. And one more time, today is World Diabetes Day as well as Children's Day. There are millions of people, and especially in every four people, if you take it, out of them, three are going to be diabetic or is already diabetic. So you're going to be one zone. If you are in Dubai, it's a very simple number. Even if you are anywhere in the world, you can send message to Instagram. But if you want to get some free program or some guidance, you can send us 00971 50136933. That is what the number, once again, 050136933. That's the number. You need to drop a message. Anyway, they will be sharing you again all the platforms. So I'm going to conclude. The message I just wanted to tell you, only the conclusion is, please take some action and make sure, if you are following a certain diet and exercise, that's the conclusion. And it's not just eating the low in calories or low in numbers of fat. It is actually a bit more than that. And if you have any chance that you wanted to be a part of our next workshop, I am going to run a live workshop, or it will be soon in this month. We are coming up with a weight loss workshop and reversing lifestyle diseases, and the primary one will be diabetics. So in this month, if you wanted to put in calendar, hopefully if you follow me in Dr. Jaison's Instagram, if you follow me in Dr. Jaison's YouTube, if you follow me in Dr. Jaison's Facebook, and if you follow me in TikTok, Dr. Jaison's, and you will be seeing some of the information out there, and you may be able to participate, and you can earn or learn more about it, what we have shared through people. It's not just by the book. I was in a conversation with somebody else regarding some medicines for diabetes. It's a quite expensive medicine. It's even better. But again, they're all talking about the medicine there. Nobody's talking about the lifestyle modification, how important and how much or what the amazing things they can do it. So conclusion is here. I'm going to wind up. Thank you very much, everyone there seeing and watching it. Please share. If you have a friend, tell them that, brother, it's if you are diabetic, if you are diabetic, you have a high chance to have a heart attack or a stroke. That is tenfold more than the normal person. And quality of life and every single thing, you are reducing at 90% of your libidos and vitality and everything. So be careful, be there. You understand, if you are not serious about it, please understand that it's not a basic thing. This is really a serious disaster, and I've seen in my life several occasions. I wanted to share hundreds of stories about it, and actually we don't have time, so I'm going to conclude. Thank you very much once again. Thank you very much for people watching me in live. Follow me in Dr. Jaison's YouTube channel. Follow me in Dr. Jaison's Facebook, Dr. Jaison Instagram, and Dr. Jaison's TikTok. And I am giving almost 1,000 people a free program. Once again, the number is 0097150136933. And finally, the program, we are going to do an amazing program that's called Die Healthy. There will be a workshop, there will be a program I'll be running, and hopefully I'll be end up with a book called Die Healthy. You may be able to read it. But again, action is important, not just listening. So take some action. Thank you very much. It's me, Dr. Jaison. Thank you, guys. Thank you. Thank you. Thank you.